You want to know how long it's going to take for your period to return after having a baby. You only breastfed for about 2 weeks, and there are two main factors that affect the return of fertility after a woman's had a baby. The first is if she's breastfeeding or not, and since you're not, that's not an issue. The second is types of birth control that you might be using. So if a mother is formula feeding her baby, usually her period will start 1 to 3 months after she started formula feeding and stopped breastfeeding. So in the next couple of months, you might start to see a period and establish more regular cycles that are predictable to you. If you go 3 months without a period, talk with your doctor and they'll ask you more questions about your history and decide if further investigation is warranted in your situation. Now let's go back to birth control for a second. There's a few types of contraception that actually affect your cycles and make it so that they're irregular or so that you don't have them at all. Maybe you just have some unscheduled spotting, and all of this would be normal based on the type of contraception you're using. So if you are using contraception, call your doctor and they'll tell you what side effects, what bleeding patterns to expect with that certain type of contraception you're using. If you're not using contraception, this might be something you want to talk to them about, because if you're not wanting to have a baby soon, you should be using a reliable form of contraception if you plan on being sexually active. They'll help you decide what type would be best for your circumstances. If you have more questions for me in the future, please feel free to ask them on our Facebook page at facebook.com/Inner Mountain Moms, and recommend us to your friends and family too.